This is All India Radio. Good afternoon. I am Anuja Kumar and with me is Prashant Kumar Sinha with the Midday News. The headlines. Centre notifies a new set of guidelines for the implementation on the extension of the nationwide lockdown till 3rd of May. Relaxation allowed in the non-containment zones from 20th of April. Government allows all agri-related activities, health services, financial institutions and supply of essential goods to function during the lockdown period. Government says Narega works allowed from 20th of April with strict implementation of social distancing norms and wearing of face masks. Union Cabinet Secretary meets State Chief Secretaries and Directors General of Police on smooth implementation of revised lockdown guidelines. Mumbai Police arrests a person allegedly responsible for instigating migrant workers for agitation and protest. President Donald Trump announces stopping U.S. funding for the World Health Organization, accusing WHO of mismanaging and covering up the spread of the coronavirus. The centre today notified a new set of guidelines in light of the extension of the nationwide lockdown till 3rd of May. In order to mitigate the hardship for the public and relax provisions for the daily wage workers and farmers, select additional activities have been allowed, which will come into effect from 20th of April in the areas which are not declared as containment zones. The government has stated that all agricultural and horticultural activities, including farming operations and farm workers in field, agencies engaged in procurement of agriculture products, including MSP operations, mandis operated by the Agricultural Produce Market Committee, shops of agriculture machinery will remain fully functional during this time. Movement of all trucks and other goods carrier vehicles with 2 drivers and 1 helper subject to the driver carrying a valid driving licence to remain functional. The government has emphasised that even empty trucks and other such transport carriers should be allowed to ply. In addition, all finance-related institutions and health-related services will remain fully functional. The government has stated that all facilities in the supply chain of essential goods, whether involved in manufacturing, wholesale or retail of such goods, through local stores, large brick-and-mortar stores or e-commerce companies should be allowed to operate. Narega works would be allowed with strict implementation of social distancing norms and face masks. Operations of oil and gas sector, including refining, transportation, distribution, storage and retailing of products like petrol, diesel, kerosene, CNG, LPG, PNG is also to be allowed. Hotels, homestays, lodges and motels, which are accommodating tourists and persons stranded due to lockdown, medical and emergency staff, air and sea crew shall remain in operation. Manufacturing units of essential goods, including drugs, pharmaceuticals, medical devices, their raw material and intermediates and food processing industries in rural areas to remain functional as well. The government has also stated that all offices of the Government of India, its autonomous and subordinate offices will remain open and police, home guards, civil defence, fire and emergency services, disaster management, prisons and municipal services will be functional without any restrictions. All other departments of state and UT governments shall work with restricted staff. All industrial and commercial establishments, workplaces, offices are directed to put in place arrangements for implementation of strict operating procedures following the containment procedures. Centre has also stated that strict penal action will be taken against any person violating the lockdown measures and asked everyone to adhere to all the protocols issued by the government. Our correspondent reports.
The objective of the guidelines is to consolidate the gains achieved during the first phase of lockdown and further slow down the spread of COVID-19 and at the same time provide relief to farmers, labourers and daily wage earners. The permitted activities from 20th of April are aimed at ensuring that agricultural and related activities remain fully functional, the rural economy functions with maximum efficiency, employment opportunities are created for daily wage earners and other members of the labor force. The guidelines also permit all health services and the social sector to remain functional, public utilities to function without any hindrance, and the supply chain of essential goods to operate without any hurdle. These are aimed at operating those sectors of the economy which are critical from the perspective of rural and agricultural development and job creation, while maintaining strict protocol in areas where safety is paramount to contain the spread of the pandemic. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
In pursuance of Prime Minister Narendra Modi's announcement, the government has issued an order prescribing extension of lockdown till 3rd of next month for containment of COVID-19 epidemic in the country. The centre has issued directions to all its ministries and departments, states, union territories and authorities in this regard, saying that the lockdown measures stipulated in the consolidated guidelines for containment of the pandemic will continue to remain in force. In its order to all states and UTs, the Home Ministry said, with the extension of the lockdown, all restrictions that have been imposed in various sectors and on various activities will continue to remain in force. The Ministry also said the states and union territories cannot dilute restrictions imposed during the lockdown as per the orders issued under the Disaster Management Act.
The Union Home Ministry has issued standard operating procedures for offices, workplaces, factories and establishments for COVID-19 management. All areas in the premises, including entrance gates, cafeteria, lifts and washrooms, must be disinfected completely. For workers coming from outside, special transportation facility will be arranged and these vehicles should be allowed to work with 30 to 40% of passenger capacity. All vehicles and machines entering the premises should be disinfected by spray mandatorily. Thermal screening for people entering and exiting is compulsory. Medical insurance for workers is to be made compulsory. There should be a provision for hand wash and sanitizer. Workplaces shall have a gap of 1 hour between shifts and will stagger the lunch breaks to ensure social distancing. There should be a total ban on non-essential visitors at sites. The Union Cabinet Secretary held a meeting with State Chief Secretaries and Directors General of Police to discuss smooth and effective implementation of revised guidelines that were issued by the Centre today. Principal Secretary to the Prime Minister, Union Home Secretary and Union Health Secretary were also present. All collectors, superintendents of police, municipal commissioners and civil surgeons also participated in the video conference.
A total of 1,076 new confirmed cases of novel coronavirus have been reported in the country during the last 24 hours, taking the total number of cases to 11,439. Health and Family Welfare Ministry said that 1,306 patients have been cured so far. During the last 24 hours, 38 deaths have been reported, taking the nationwide toll to 377. Indian Council of Medical Research ICMR has tested 2,44,893 samples so far. Yesterday, 26,351 samples were tested by the various government and private laboratories in the country. ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 171 government laboratories, 3 collection centres and 73 private laboratory chains have been given approval to conduct the test for COVID-19. In Maharashtra, Mumbai police have arrested a person allegedly responsible for instigating the agitation that led to the protest by migrant workers in the metropolis yesterday. The person identified as Vinay Dubey was allegedly responsible for instigation of the protest, which involved around 1,000 migrant workers at Bandra station and elsewhere demanding to be permitted to move to their native places in UP and other states. The protest, which breached the law forbidding public gathering in the wake of city reeling under coronavirus epidemic, posed a big threat of further spreading of the disease. Dubey was detained in Airoli in Navi Mumbai last night for threatening to stage huge protest by migrant workers at Kurla on 18th of April. He was later handed to Mumbai police, who took him to Bandra police station and registered multiple cases under the Indian Penal Code and the Epidemic Diseases Act. The police said he will be produced before the court today. Dubey allegedly started a campaign, Chalo Ghar Ki Or, for the North Indian migrant workers and has urged support for the cause through his Facebook account. He also tweeted, threatening a nationwide agitation if the government fails to facilitate going back of migrant workers to their homes in native places by the 18th of this month.
Procurement of wheat by government agencies will start across the country today. Despite unseasonal rains and hailstorm this year, the Rabi crop has recorded a bumper yield and farmers need the support of official procurement agencies to purchase their agricultural produce. Consumer Affairs Minister Ramvilas Paswan has asked states and union territories to put all arrangements in place to commence wheat procurement for the Rabi market season of 2020-21. He said social distancing norms should be strictly followed during the procurement. Mr. Paswan said a duty roster for staff, workers and labourers should be prepared by all procurement centres, godowns, offices and to ensure no shortage of labour. Agriculture Minister Narendra Singh Tomar today launched the All India Agri Transport Call Centre at the Krishi Bhavan in New Delhi. This will facilitate interstate movement of perishables in the current situation of lockdown due to the COVID-19 threat. The call centre numbers are 1800-180-4200 and 14488. These numbers can be called from any mobile or landline phones any time of the day or night. The 24/7 service of All India Agri Transport Call Centre is an initiative of the Department of Agriculture, Cooperation and Farmers' Welfare for coordination between states for interstate movement of perishables.
227 flights have transported over 407 tons of essential medical supplies across the country under the Lifeline Udan initiative during COVID-19 lockdown. Civil Aviation Ministry has said that the government is determined to support India's war against COVID-19 by transporting medical air cargo within India and abroad in the most efficient and cost-effective manner. Helicopter services, including Pavan Hans Limited, have been operating in Jammu and Kashmir, Ladakh, Islands and Northeast region, transporting critical medical cargo and patients. Domestic cargo operators SpiceJet, Blue Dart and Indigo are also operating cargo flights on a commercial basis. The ministry said Air India operated the first flight between Mumbai and London on Monday, carrying around 29 tons of fruits and vegetables to London and returned with over 15 tons of general cargo material. Industry body FICCI and ASSOCHAM have supported Prime Minister Narendra Modi for extending the nationwide lockdown till 3rd of May for saving each and every people from the unprecedented pandemic, COVID-19. In a statement, the FICCI said Indian industry will comply with all the directions given by the Prime Minister and looks forward to the detailed guidelines on working of units in essential goods and services. FICCI President Sangeeta Reddy said the Prime Minister has been a source of great inspiration for all of us and has coalesced people from all walks of life together in this hour of crisis. ASSOCHAM Secretary General Deepak Sood said Prime Minister called to the people and the state and local authorities to strictly enforce the lockdown till the 20th of April, for qualifying to get relaxation is a double-edged tool for effective results. He said the Prime Minister's concern for the most vulnerable sections of the society and the agriculture is highly appreciated and would help revive the economy after coronavirus is gone.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Centre notifies a new set of guidelines for the implementation and the extension of the nationwide lockdown till the 3rd of May. Relaxation allowed in non-containment zones from the 20th of April. Government allows all agri-related activities, health services, financial institutions and supply of essential goods to function during the lockdown period. Government says MG Narega works allowed from 20th of April with strict implementation of social distancing norms and wearing of face masks. Union Cabinet Secretary meets State Chief Secretaries and Directors General of Police on the smooth implementation of revised lockdown guidelines. Mumbai Police arrests a person allegedly responsible for instigating migrant workers for agitation and protest. President Donald Trump announces stopping U.S. funding for the World Health Organization, accusing the WHO of mismanaging and covering up the spread of the coronavirus. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
In our series Experts Speak on All India Radio, we bring you the views of some leading medical experts on COVID-19. Talking to AIR News, Dr. B.N. Gangadhar of National Institute of Mental Health and Neurosciences, Bengaluru, said that COVID-19 infection is not fatal in every case and 95% of COVID-positive patients recover.
First of all, and very important, is to realize COVID, although it is an illness which causes death in some, but be sure that 95% are going to get better. And this is not some illness which will be fatal in everyone. 95% are going to get better and go away. And in the other group of 5% of the people, of course, there can be some unfortunate event.
Dr. Rakesh Garg of AIMS said spread of COVID-19 can be contained if people follow the guidelines and take necessary precautions.
If the social isolation continues in a very nice way, then probably we'll be able to have containment. So there may be some clusters which are upcoming, but with good contact tracing and with good quarantine of those who have suspects or those who have contact with these positive patients, if they can do a good amount of quarantine at respective places, then probably we think that the containment of the virus may be a good option, and we hope that it would happen.
In Rajasthan, with 29 more corona-positive cases reported today, the number of infected persons has gone up to 1,034 in the state. The state capital, Jaipur, is most affected, where 15 new cases were reported today, and total of 468 corona cases have been reported so far. Jodhpur, Banswara, Kota, Tonk, Bikaner and Jhunjhunu have emerged as hotspots of COVID-19. More from our correspondent.
Chief Minister Ashok Gehlot has instructed to work on a war-footing level to prevent corona infection in Jaipur. The administration has identified 13 blocks in the walled city area and special efforts are being made for containment of COVID-19 there. Curfew continues in all the affected areas and ration supply is being done by the administration. Quarantine facilities being developed for 20,000 people in different parts of the city. The additional police force has been deployed in the affected areas of the city. Several important steps have been taken to protect medical teams and police personnel from infection who deployed in the city. Jitendra Dwivedi, AIR News, Jaipur.
A total of 51 new confirmed cases of novel coronavirus have been reported in Delhi during the past 24 hours, taking the total number of cases to 1,561. The Delhi government has confirmed that 31 patients have been cured and discharged, while 30 deaths have been reported in the national capital. A total of 85 cases are under investigation and 16,282 tests have been conducted so far. Meanwhile, the Delhi government has extended its list of cluster containment zones to 55 to contain the spread of COVID-19. The area around J Block in Khirki Extension, Jain Mohalla in Chirag, Delhi, C Block in Janakpuri, Bara Hindurao, Nawabganj, B Block in Shastri Park and small parts of the area of Jahangirpuri are the 8 new containment zones declared by the state government. Orders have been given to seal these areas under the Operation Shield of the Delhi government.
Kerala continues to contain the COVID-19 infection in the state with the highest recovery rate in the country.
As per the data released by the Health Ministry, Kerala records over 52% recovery of COVID-19 infection, highest in the country. So far, 211 people had completely recovered from the disease. Presently, 173 people are under treatment for COVID-19 in the state. The number of people under observation drastically came down to over 1 lakh, which records of over 5,000 people out of observation in a single day. Meanwhile, the authorities informed that the biggest cultural extravaganza of Kerala, Thrissur Puram, is called off for the year for the first time in 58 years. The state government will decide on the further measures of lockdown tomorrow after the state cabinet meeting. Mayusha for AR News from Thiruvananthapuram.
In Meghalaya, 6 family members of the Bethany Hospital doctor who passed away in Shillong in early hours today have tested positive for COVID-19. Earlier, Meghalaya's first COVID-19 patient passed away at Bethany Hospital this morning. The doctor who used to treat patients at Bethany Hospital units in Shillong and Nongpo have tested positive for COVID-19 on Monday. The doctor was the owner of Bethany Hospital and was 69 years of age. Confirming the demise, Chief Minister Conrad K. Sangma said in a tweet that the first COVID-19 patient in Meghalaya passed away this morning at 2:45 a.m. He said of the 68 tested so far, 6 family members tested positive and 6 other cases are being retested. This is the second death due to COVID-19 in the northeast. Earlier, another patient died in Silchar Medical College Hospital in South Assam.
In Bihar, the number of positive cases of the coronavirus have gone up to 70, with reporting of 4 more cases today. 3 are from Nalanda, who had returned from Dubai, while the remaining one is from Munger. In all, 29 persons have so far been cured from COVID-19. 1 person from Munger died due to the virus infection.
The Hyderabad-based CSIR Center for Cellular and Molecular Biology, CCMB, is testing new kits for coronavirus besides undertaking genome sequencing at its cell culture system. Director of the Premier Laboratory, Dr. Rakesh K. Mishra, informed AIR News that they are getting good indications for developing cheaper kits. He further said the alternate options are being tried at the CCMB and they are based on local origin without depending on imported kits. Dr. Mishra further said these alternate methods are cost-effective and also can test large-scale samples at a time. He added that new strategy of testing also has good indications for increasing the testing capacity for coronavirus.
We are doing several hundred tests every day. The number of samples that come, we give the results within 12-13 hours with all full reporting and uploading the results. And we are testing new kits because one of the difficulties we are facing is supply of the reagents for the testing. So we are testing alternate options, especially which are of local origin, so you don't have to depend on the import, because import has become very big problem. Every country is wanting the same thing, and there are some good indicators for that. We are also developing methods which can be very cheap and can be used very large scale, but that's a matter of research. It might take some more time, and we cannot guarantee that it will be successful, but we are putting our best effort and there are good indications.
In Gujarat, 56 fresh cases have been reported today, taking the total number of positive cases to 695. The State Health Department said 42 cases were reported from Ahmedabad, along with 6 in Surat, 3 in Vadodara and Panchmahal, while 1 each in Botad and Khera. More from our correspondent.
After the Congress MLA from the walled city, Imran Khedawala, was found positive for COVID-19. Meeting halls at Gujarat Secretariat have been sanitized, where he held talks with CM Rupani and briefed media yesterday. Principal Secretary of Department of Health, Dr. Jayanti Ravi, said although the meeting was conducted while maintaining social distancing, CM Rupani was checked by senior doctors today. On the advice of doctors, henceforth CM will conduct all the meetings from the home. Meanwhile, Mr. Khedawala was admitted hospital in Ahmedabad. Samples of the other 2 MLAs from the walled city were also taken and they are all home quarantined. AMC is stressing the people who were in contact with Khedawala and they all will also be quarantined. Aparna Khun, AIR News, Ahmedabad.
In Riyasi town of Jammu district, a 74-year-old retired government employee, Yog Raj Mengi, has distributed over 6,000 masks from his monthly pension. Not only this, he has also started distributing free ration to the needy people in the township. In Mizoram, Chief Minister Zoramthanga asked the police and armed forces to beef up security measures along the state's borders. In a meeting with the officials of the Home Department, Assam Rifles and Border Security Force yesterday, the Chief Minister said that the state borders must be guarded more strictly as COVID-19 cases have now been confirmed in all neighbouring countries and states. He said that security forces along the borders must make sure that no illegal trespassers secretly cross over into the state. Mr. Zoramthanga also emphasized on concerted coordination among Assam Rifles, BSF, State Police, the village-level task force and the NGOs to combat the threat of COVID-19. State Home Minister Lal Chamliana also attended the meeting. Assam Rifles and BSF, which man the international borders with Myanmar and Bangladesh, gave reports of border vigil. In Tamil Nadu, the Chennai Municipal Corporation has tightened restrictions relating to wearing masks while coming out from homes. The civic body has announced that those pedestrians without masks will be fined 100 rupees each, while vehicles of those travelling without masks will be confiscated and their licenses suspended for 6 months. Meanwhile, in Tamil Nadu, the number of fresh cases of COVID-19 infection has dipped to 31 yesterday. It is the lowest ever record of new cases this month. More from our correspondent.
The number of discharged people in the state is set to go up considerably as many of the COVID-19 patients are now free from its symptoms. However, as per the protocol, they are being kept under hospital care to complete 14 continuous days to doubly ensure that they are fully cured. Meanwhile, the state government has initiated a medicine on call facility and it has been rolled out yesterday. The officials managing the service told AIR News Initially, about 4,000 medical stores have joined the chain, which is now growing by leaps and bounds. The people are asked to call the toll-free number 1800-1212-172. The call details will be shared with their nearest medical store personnel who will verify the prescription and deliver the medicine. In short, even during the lockdown period, the medicines are just a phone call away. Jai Singh, AAR News, Chennai.
In Madhya Pradesh, the number of people infected with coronavirus in the state has crossed 750 mark. Cases are increasing in Indore and Bhopal. The number of infected people in Bhopal has increased to 158. Chief Medical and Health Officer Dr. Praveen Jadia said today that out of 1,142 samples sent to Delhi, 200 samples were tested in Indore district yesterday, out of which 117 patients have been diagnosed with infection. Thus, the number of infected people has increased to 554. According to Dr. Jadia, the new cases coming up are of people exposed to old patients who have already been placed under precautionary medical supervision. Therefore, it cannot be said that the transition has failed in the society.
BCCI President and former Indian cricket captain Sourav Ganguly has appealed to the people to follow all government directions during the lockdown period.
These are very testing times in our lives, but we will fight it. Listen to what every state government says, listen to what every health department says, listen to the directives of the central government. As they say, it's important to stay at home. Isolation is very, very important. Be safe and be healthy, and most importantly, be sensible.
Indian cricketing legend Sunil Gavaskar has also urged people to follow the guidelines to combat COVID-19.
Please maintain personal hygiene, avoid gathering in places because that is where the virus can spread and you might also catch it unknown to you. Please avoid unnecessary travel. Believe me, that's the hardest thing for me myself because I am on a plane every third or fourth day. So please try and avoid unnecessary travel.
President Donald Trump has announced that he has instructed his administration to stop U.S. funding for the World Health Organization WHO, which he accused of grossly mismanaging and covering up the spread of the novel coronavirus. Mr. Trump said,
I am instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus.
Mr. Trump noted that the United States contributes to the WHO $400 to $500 million annually. The India Meteorological Department has predicted a normal southwest monsoon for the country this year. IMD today issued the first stage long-range forecast for southwest monsoon season rainfall for this year. In an online briefing, IMD Director General Mrityunjay Mohapatra said that the long period average of monsoon will be 100%, which falls in the normal category. Secretary, Ministry of Earth Sciences M. Rajivan said the IMD has revised the onset and withdrawal dates of the monsoon from this year. However, the normal onset date over Kerala, which is June 1st, will remain the same.
The world's most famous cycling race, the Tour de France, has been postponed in the wake of the coronavirus pandemic. The French newspapers reported that the 3-week race was set to start on the 27th of June in the Riviera city of Nice, has been set for August. This year's event has 21 stages, with the longest of them stretching 218 kilometers, that is 135 miles. The decision came after French President Emmanuel Macron announced in the speech to the nation that all public events with large crowds have been cancelled until at least mid of July. The last time the tour was not held was in 1946, with the nation still emerging from World War II. It was also stopped during World War I.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Sanjay Pandey from GB Pant Hospital will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. And now, before we end the bulletin, the headlines once again. Centre notifies a new set of guidelines for the implementation on the extension of the nationwide lockdown till 3rd of May. Relaxation allowed in the non-containment zones from 20th of April. Government allows all agri-related activities, health services, financial institutions and supply of essential goods to function during the lockdown period. Government says MG Narega works allowed from 20th of April with strict implementation of social distancing norms and wearing of face masks. Union Cabinet Secretary meets State Chief Secretaries and Directors General of Police on smooth implementation of revised lockdown guidelines. Mumbai Police arrests a person allegedly responsible for instigating migrant workers for agitation and protest. And President Donald Trump announces stopping U.S. funding for the World Health Organization, accusing WHO of mismanaging. And with that, we end the Midday News.